Okay, so chapter 15, diagnosis coding. Okay, so medical coding is the process of assigning alphanumeric characters that represent the diagnoses patients have and services they receive. The diagnosis codes identify the reasons that healthcare services were provided. Procedure codes describe the services performed for patients. HIPAA mandates that approved code sets for all covered entities. Medical codes used to compile and report stats regarding health status and health trends. The physicians responsible to code and bill for all services they provide. Okay, so the role of medical assistants in coding. They assist in communication between coders and physicians when a question arises. They provide appropriate diagnosis codes when insurance pre-authorization is required for a procedure. They facilitate communication with attorneys who may need information about medical codes related to injured patients they represent. Answer patient questions about the meanings of codes on their insurance claims or other paperwork. They review or facilitate medical documentation to help ensure it provides adequate specificity for coding. So codes have to be very detailed. Um, so it requires knowledge of anatomy and physiology, clinical procedures, um, local, state, and federal regulations, attention to detail, scope and limitations of MA training. So just like I go over with you all about, where this is in the body and what all those medical terms mean, is because if you see that somebody, is supposed to have a cholecystectomy, that way you'll know what it is so you can code it correctly. Okay, so the history of diagnosis coding. Um, Jacques Bertillon creates the Bertillon classification of causes of death. In 1898, the American Public Health Association adopts his classifications. And in 1901, they published the first coding manual called International Classification of Diseases, Volume 1. And there go my dogs. Okay, so this table 15.1, this is the history of diagnosis coding. Um, this is also a more current list. Overview of ICD-10. So update and major revision to ICD-9 CM. HIPAA mandated code set for billing and reimbursement effective October 1st, 2014. Detailed diagnosis codes reduce need for attachments to claims, and they provide more detailed and higher quality data for tracking quality, safety, effectiveness of health services. So this is just a table to shows you the difference between ICD-9 and ICD-10. I actually went to the class for ICD-10 when everything was switching over, and my God, there are so many codes, lots of codes, 70,000 plus, and they add more all the time. Um, so the expected benefits of it, detailed diagnosis codes, um, higher quality data for tracking, expected to save time and money in the long run. Combined with increased use of electronic health records, it provides more consistent and more detailed data for physician use. Um, the coding system in the United States becomes more consistent with what is used in other countries. We are always different than everybody. Public officials can better track and respond to domestic and international public health threats. And it provides the flexibility to add codes as needed in the future. So, compliance with codes. Healthcare providers must follow rules established by multiple federal, state, and county government agencies. Some rules specific to healthcare, others pertain to any type of business. Violating coding and billing rules can be classified as fraud or abuse. So, what is fraud? Knowingly billing for services that were never given, or billing for a service that has a higher reimbursement than service provided. So, if you ever get a office note from your physician when you go, if you look at, I think it's like towards the bottom, um, it'll say like level whatever. So to bill a level 4, you have to spend X amount of time with the patient. You have to discuss this, and this. So when it goes to the coders, if he doesn't have all that documentation, they can't send it out as a level 4. It has to be a 2 or 3, just depending on, what criteria he meets. Abuse is mistakenly accepting payment for items or services that should not be paid as a result of improper coding and billing. The Inspector General fights waste, fraud, abuse in Medicare, Medicaid, and more than 300 other health hospital programs. Patient Protection and Affordable Care Act, the PPACA, mandates compliance programs for providers who contract with Medicare and Medicaid. So this is characteristics of a compliance program. It's table 15.4. So the organization of the ICD-10 manual provides codes to identify diagnoses physicians give to patients. So the physician has to tell you what the patient's diagnosis is for it to be coded. Like I said, there's over 70,000. They're updated annually and take effect October 1st of each year. Use the addition of the ICD-10 that was in effect on the date of service. So these are the sections in the ICD-10 manual and the type of information. So conventions, specialized rules, abbreviations, formatting, and symbols that alert users to important information. Key to selected symbols usually appears at the bottom of each page. Certain conventions are universal to all ICD-10 manuals. Others are specific to the publisher. The codes are alphanumeric, consist of both letters and numbers. So convention excludes 1, notes appear immediately under a code in the tabular list. Means that the condition represented by the code and condition listed as excluded are mutually exclusive and should not be coded together. Occurs frequently with conditions that may be either congenital or acquired. Excludes 2, notes appear immediately under a code in the tabular list. Means that the condition excluded is not part of condition represented by the code, but the patient may have both conditions at the same time. These conditions are not mutually exclusive. 7th character code is reserved for special use, most commonly the episode of care for injuries, must be assigned from tabular list. So if you read some codes, it'll say sucked into a jet engine subsequent encounter. So that's what they mean by the episode of care. Placeholders, the X appears in certain codes 4, 5, or 6 characters long. So here are the conventions, as you can see. More. Okay, so official guidelines for coding and reporting. Those are rules that provide directions for how to code selected conditions and establish the rules for how to identify which diagnoses should be reported on a claim for any given patient. HIPAA requires that coders adhere to the official guidelines for coding and reporting when assigning those diagnosis codes. They explain the conventions that are universal within the code set. So the Index of Diseases and Injuries lists conditions, diseases, and reasons for seeking medical care. It's organized alphabetically by main term and subterms. After identifying the preliminary codes in the index, you verify them in a tabular list. There's a table of neoplasms, of drugs and chemicals, and index to external causes. Okay, tabular list. Alphanumerically sequenced list of all diagnosis codes divided into 21 chapters based on cause or etiology and body system. After locating diagnosis in the index, verify the code by referencing the tabular list. So this is the tabular list. So chapter 1 is certain infectious and parasitic diseases. The codes are A00 to B99. And I'll show you this when I come back on Wednesday. We'll we'll go through a diagnosis. I mean, an ICD-10 book. Excuse my dogs. They're fighting right next to me. Anybody have any questions? Email me, call me, text me, send me a smoke signal. But I'll put up another lecture for tomorrow. Y'all have a good night.